Hello everyone, welcome again. This is the lecture on cardiac septation and we are talking about the atrium now. We know initially the heart tube contained a common atrium. We'll now travel from the common atrium to two separate atria. This section has been further subdivided into the formation of septum within the common atrium, what role does the foramen ovale play, and finally we'll talk about the fate of the left atrium and the pulmonary vein. So firstly, let's talk about septation of the common atrium. So before getting into that, let's take a look on this figure. So this is the common atrium. Here you can, this one in yellow is the septum primum. However, this is the late septum primum. We'll see why I'm calling it a late septum primum. This in green is the septum secundum. These are the openings of the vena cava, and these openings, we'll see what these openings are. So now let's get into the septation. It's the end of 4th week of development. Now a sickle-shaped crest grows from the roof of the atrium. So this is the roof of the atrium, all right. Now a sickle-shaped crest is now growing from the roof, from the top of the atrium into its lumen. This is the first part of the septum primum. So it's a sickle shape. It is sickle-shaped initially, and it grows from the roof, from the top of the atrium towards the lumen, towards the inside, and this is the first part of the septum primum. The two limbs, if this was a sickle, these would be the limbs. The two limbs of the segment now extend towards the endocardial cushions in the AV canals. So we saw in the previous section that there were endocardial cushions which were actually extracellular matrix proliferations which were covered by the endocardial cells and they helped in the formation of AV canals. So now the two limbs of this sickle-shaped septum primum tend to move towards the endocardial cushions which lie in the AV canals. So ostium primum, what is ostium primum? Is an opening between the lower end of the septum primum and the endocardial cushions. So ostium primum is actually, this is the ostium primum. It is an opening between the lower end of septum primum and the endocardial cushions of the AV canals. All right. So now the superior inferior endocardial cushions grow along the edge of the septum primum. So the endocardial cushions, the superior inferior, they continue to grow along the edge of the septum primum. Now this growth of the endocardial cushion, now it closes this ostium primum. However, before closure of this ostium primum, there are small there's segments of cell death which eventually coalesce and form perforation in the upper part of the septum primum. So this coalition of these perforations lead to the formation of ostium secundum. So ostium secundum can be seen in this diagram. This is the ostium secundum, the one in yellow through which the arrow is passing. So moving on, this is responsible for the free flow of blood from right to left in the common atria. So now recapping and going to the previous figure. So what do we have? Initially, it's a common atrium. Now a sickle-shaped fold tends to grow from the roof of the atrium towards the endocardial cushions. So this is the roof of the common atrium. And a sickle-shaped fold tends to grow towards the endocardial cushions within the AV canals. Now the these limbs of the sickle now tend to grow towards the endocardial cushion in the AV canal. The space between these limbs and the endocardial cushions is known as ostium primum. Before closure of the ostium primum, now, how does the ostium primum close? By the growth of endocardial cushions along the tip of the septum primum. However, before closure of the ostium primum, small perforations by cell death tend to appear in the upper segment of the septum primum. So these perforations now coalesce and they form the ostium secundum. So this is the ostium secundum. Now this ostium secundum allows the flow of blood from the right side, from the left side of the heart to the right side. So we've discussed all of this and also recapped it. So moving on. So the right atrium lumen increases due to incorporation of the sinus horn. At the same time, now the sinus horn has been incorporated into the right atrium, as a result of which the size of the right atrium increases. Now a crescent shaped fold appears, which is known as the septum secundum. Now this green, this one in dark green, is the crescent shaped fold that appears within the right atrium after the sinus horn has been incorporated into it. This is known as the septum secundum. However, it never completely partitions the atrial cavity. Here you can see a small hole in the septum secundum. It does not ever completely partition the atrial cavity. The anterior limb, this is the anterior limb, it extends to the septum in the atrioventricular canal. This is the AV canal, and here it extends towards the septum in the AV canal. So now let's see the role of foramen ovale. So the left venous valve and the septum spurium, we've talked about these before. They fuse with the right side of the septum secundum. So there's a fusion between the left venous valve of the right sinus horn of the sinus venosus and the septum spurium with the right side of the septum secundum. Now the free concave edge of the septum secundum begins to overlap the ostium secundum. So the ostium secundum, which was formed in the upper portion of the septum primum, is now being covered by the free concave edge of the septum secundum. This is the region of the foramen ovale, and this is where all the action is going on currently. So the opening left by the septum secundum is known as the foramen ovale. So foramen ovale is actually the opening within the septum secundum. So the upper part of the septum primum disappears. So the upper part of the septum primum, it completely disappears. And what does the lower part do? What is the fate of the lower part? It actually forms the valve of the foramen ovale. So the remaining portion of the septum primum forms the valve of the foramen ovale. So before getting into the reversal, I'll recap it one more time. What happens is, now here, so the left venous valve and the septum spurium. So we have two things: the left venous valve of the right horn of the sinus venosus and the septum spurium. Both of them are fusing with the septum secundum. Now the free concave edge of the septum secundum now approaches the ostium secundum, which was present in the septum primum. It covers the upper part of the septum primum now completely disappears. The remaining portion of the septum primum forms the valve of the foramen ovale. And what is foramen ovale? In itself, foramen ovale is the opening that is left in the septum secundum. Alright, I know it's a mouthful, it can be a bit boring and a bit difficult, but if you try to keep up with me, you'll be able to understand it much clearly. So now there's a reversal of blood flow. Now after birth, lung circulations begin. Okay, so circulation in the lung begins after birth. Now pressure in the left atrium, it increases. The left atrial pressure increases because now the blood that has gone to the lung is coming back into the left atrium. So valve of the oval foramen is pressed against the septum secundum. So this is the oval foramen. Before birth, here you can see from the right atrium, the blood went to the right ventricle. From the right ventricle, the blood went into the outflow tract. That is the pulmonary trunk, and from there into the ductus arteriosus and then into the aorta. Here you can clearly see it. However, when after birth, this ductus arteriosus has been closed. Now the blood goes to the lungs and come back into the left atrium, as a result of which the left atrial pressure increases and the valve of the foramen ovale is now pressed against the septum secundum. What was forming the valve of the foramen ovale? It was the remaining portion of the septum primum. What happened to the upper portion or the proximal portion of the septum primum? It disappeared. So this abutting of the valve of oval foramen with the septum secundum causes obliteration of the oval foramen. This oval foramen is now closed. So the right and left atria are now completely separated with no shunting of blood in between. Here you can see there is no shunting of blood. Here there was shunting of blood. However, in this case there is no shunting of blood. Now, probe patency. Probe patency occurs in about 20% of the cases. In this condition, we have fusion of the septum primum and septum secundum. However, it is incomplete. There is a narrow oblique cleft which remains between the two atria. This is known as the probe patency of the oval foramen. So, the fusion between the septum primum and the septum secundum is incomplete. As a result, there is a narrow oblique cleft between the two atria, and this is known as the probe patency of the oval foramen. It does not, however, does not allow the intracardiac shunting of blood because it's a very narrow oblique cleft. So let's talk about the fate of left atrium and the pulmonary vein. So we're talking about this segment now. This is an adult completely formed heart. However, we'll take a developing heart and how does it reach this adult stage. So the primitive left atrium now begins to expand. The mesenchyme, which is at the caudal end of the dorsal mesocardium, it begins to proliferate. So what was mesocardium? Mesocardium was a layer of peritoneum that was hanging the heart from the body cavity. So mesenchyme at the caudal end of the dorsal mesocardium, it begins to proliferate. Now the septum primum grows downward from the roof of the atrium. We have already discussed it. The septum primum, it begins to grow from the roof towards the endocardial cushions within the atrioventricular canals. The mesenchyme forms the dorsal mesenchymal protrusions. So if you can see here in pink, this is the interatrial septum, and the mesenchyme now has already formed the dorsal mesenchymal protrusions. So tissue now grows within the septum primum towards the atrioventricular canals. Obviously now it is supposed to close the atria, so that tissue is now growing from the septum primum towards the AV canals. So the pulmonary vein lies within the developing dorsal mesenchymal protrusion. So the dorsal mesenchymal protrusions are important because the pulmonary veins lie there. So it is positioned in the left atrium. By growth and development of the dorsal mesenchymal protrusion. So dorsal mesenchymal protrusion, they grow and develop in such a way that they are positioned within the left atrium. The remaining portion of the dorsal mesenchymal protrusion contributes to the endocardial cushion of the atrioventricular canal. So there's a contribution to the endocardial cushion of the AV canal by the remaining portion of the dorsal mesenchymal protrusions. So the main stem of the pulmonary vein that opens into the left atrium, this is the main stem of the pulmonary vein opening into the left atrium. It sends two branches to each lung. Here you can see two branches are being sent to each lung. With expansion, the main stem is incorporated within the left atrium until the branching point. So an important fact that the expansion of the left atrium, it incorporates the main stem of the pulmonary vein till the branching point. Now there are four separate openings, two of which can be viewed in this figure for pulmonary veins within the left atrial chamber. So this is how the pulmonary vein finally comes to lie within the left atrium. They originated in the dorsal mesenchymal protrusion. These dorsal mesenchymal protrusions came to lie within the left atrium, as a result of which they also contributed to the endocardial cushions. After contributing to the endocardial cushions, they helped in the formation of adult pulmonary veins, and the main stem of the pulmonary vein was incorporated into the developing left atrium by till the branching point of it. So this was all about this section. In this section, we talked about how the developmental changes occur in adult heart and what were the fates of the developing atria and the pulmonary veins. I know this section was a bit extensive and a little bit boring, but I can assure you, if you understood it or if you try to understand it, it would help you a lot in understanding the clinical consequences of these conditions. For further sections, please keep watching sqadia.com.